Welcome, viewers and listeners, to another episode of ULab Central. Today, I have with me Leah. Leah, why do you feel that the audience should be excited about our conversation today?
Well, I think that one thing that our company is bringing to the landscape of healthcare and home care is a focus on proactively looking at family lifestyles. And so today we know that there's so many people suffering from dementia and Alzheimer's and stress and anxiety.
Yeah.
It's really a big problem, especially in America. And so I think that a lot of people aren't really sure of how to manage these conditions or be proactively working towards, as a family, to not be in that situation. So one of the things that our company is doing as a home care agency, Perfect Care Match is the name of the company, and we provide senior care to folks that are in need. But we do have some patients that are younger as well. So we don't service children at this time, but we focus on folks that aren't able to live independently at home. But what we understand is that a lot of the conditions that are affecting our senior population do involve things that could be done earlier on. Um, Maybe a different lifestyle approach would help impact their health in different ways.
Yeah.
Um, for, for instance, the diabetic crisis that we've got going on obviously is dietary related.
Yeah.
It's got to do with our food source and also the stress and all the things we're doing as human beings today versus years ago. There's a lot more impacts on our health from being available all the time, not living in the circadian rhythm the way that nature plans us to. So that's kind of what we're doing a lot of education about so that we can help families build generational health. We oftentimes talk a lot about generational wealth, and generational wealth is really important too, but without the health piece, you really have nothing. So it's actually, when you look at the priorities of what your existence should be on, it
Yeah.
should be health.
Thanks for bringing that up. I mean, in just a previous episode, I was talking about generational wealth with another gentleman, but you've got this amazing perspective of generational health. Do you want to share a little more, spread some light on that? Uh,
Yes, I think my life path has been kind of a journey, especially with dementia. My grandfather had Alzheimer's, and he was affected in the 80s, and I was a child. And so, with that experience, excuse me, he was very agitated in the nursing home settings. He was unsafe at home, turning on the stove, wandering outside the house. So my family at that time chose to admit him to a skilled nursing facility. And back then, we didn't have the same knowledge about Alzheimer's and how, the behaviors are affected by how we're approaching folks. And so that unveiling of how we can approach folks with Alzheimer's didn't come till later on. And so it was a very traumatic, long journey where he was bounced around from nursing home to nursing home. And it was very confusing to me as a child, what is going on? And then he did pass away, and he was restrained and heavily medicated when he passed. So that obviously was, a big sad moment for our family and how he actually passed. And then about 10 years later, my grandmother, I was older, obviously, and I was actually 18, and my grandmother, totally cognitively fine, but she was 90 and she started having falls. So she couldn't be alone either. And so I lived across the street. I was named after her. I, had a special relationship with her. And so I actually started, staying with her at night and stuff. I was going to college, and it was local, fortunately. So, I ended up taking care of her for 6 years in her home until she passed. And so then, just being on this track, I went. I graduated college. I went out into the world and worked in different industries, tech and stuff like that. But I felt like I wanted something more purposeful. I had had a near-death experience where a horse had reared up that I was training, and she fell over backwards on top of me. And it stopped my heart. And my dad was there and he resuscitated me. And I had two young children at the time. And so I really was like, I want more purpose in my life after that experience because having something as dramatic as that really, wakes you up. So I did look at my life and say what would be, effective for me. And as the universe works, I ended up having an opportunity in senior care, and I loved it. And I just have pursued that route for all of these years, and also health, wellness. And I had post-traumatic stress after that event happened because I kept thinking my heart was going to stop. So I resolved it by using a lot of holistic remedies to avoid taking medications. And yoga was very helpful, different aspects of holistic practices that I employed. I ended up feeling like I needed to start learning and become a teacher. And so that's where I went with my route. And I've done certifications in emotional freedom technique, which was very helpful to me. I've been a meditation teacher for many years, and a claim to fame is I was a meditation teacher for over 500 seniors in New England. Um, I've taught a lot of healthcare workers different mechanisms so they can, help themselves too in the stress that we've had through COVID. So all of those things happened, and I really, you know, I really feel joy in that. And in 2020, I began my company, Perfect Care Match, and the focus was on senior care, but I knew that I wanted to expand it to somehow impacting the younger generation so that they could work on their health and wellness, and that's where we are now.
So, where you started, right? I mean, do you think those early years trying to take care of your grandmother created the foundation for probably ending up with this purpose in life and then creating that thought process?
Yeah, my my philosophy is that we're here to learn, and everything has been monumental in my path, like the direction that I've taken. I think about those things that happened so early on and how things transpired later on that also turned me in this direction. And I feel like it wasn't a coincidence that it was, it's my path and it's my purpose. And it feels good to know your purpose, so if people are in question of that, if you look at your whole life and kind of see what happens and what struggles that you have, because that was a struggle for me having that accident. I actually couldn't walk at first for a couple weeks. I really struggled. I had to go through PTOT to, remind my body how to move again. I still have pain, but not like I did, it's much improved. That was 20 something years ago that happened. Well, 25 years ago that happened, the horse accident. And it really changed my life in so many ways.
So, you've talked about teaching and having such a huge audience to teach. Uh, what's this one step that you first take with your students? Uh, Specifically senior care, or if you want to talk about the nursing staff who you work with, uh, who do you want to talk about? What would you like to share as to the first thing that you want to talk to them about when you start something with them?
Well, I think that everybody is impacted by what is happening to our elder population because the statistics are 1 in 2 people over 85 have Alzheimer's.
Okay.
And so that's put out by the Alzheimer's Association. And then 1 in 5 family caregivers actually pass before the person that they're caring for passes that has Alzheimer's. So that's pretty significant. And it shows, if you've got 1 in 2 people over 85 having Alzheimer's, and then 1 in 5 individuals that are caring for their loved one with Alzheimer's passing, then what are we doing? How are we going to manage that? And how are we going to support this population? Because they're already there. It's
Yeah.
not like we can turn back the time and make a change in their health. It's just where we're at. So how do we support them? And our services are really great in doing that. And you can go to our website, perfectcarematch.com, and read all the things we're doing for vetting our care staff. We make sure that we're working with professional caregivers that have either worked in hospital settings, nursing homes, that sort of thing. Most of our caregivers are actually traveling CNAs, certified nursing assistants, home health aides, or personal care attendants. They come from all over the country, and currently we cover all of Massachusetts and Maine. And we're actually franchising as well now. So our company is being offered as a franchise opportunity throughout the US. And we have a few lining up. That just launched in January, so we're really excited about that. But the initiatives of the company, the mission of the company is really to help as many families as we can
Yeah.
and impact them in positive ways. And so we're doing everything from I've written some books. I have a co-writer that helps me. Like I'm not Superwoman.
Yeah.
Wish I was, but I do have support, and we've put out some wonderful books on Amazon. You can go to the website and check out our workshops as well. I'm a certified Chopra instructor, so I am specializing in Ayurveda. So we do workshops on Ayurveda, on EFT, meditation for brain health, the Blue Zone diets. I'm actually also a certified nutrition coach through Harvard Medical School.
Uh-huh.
So there's a lot of things that I've done to build up my wealth of knowledge so that I can make sure that I'm
Yeah.
conveying, good content to people that they can depend on, that they can trust.
Right. So you meant there were two things I want to catch on now. You mentioned you're not Superwoman, or probably you are, and then about the content that you share with people, right? So first to that, you're now in the role of a CEO. You're now running a company across these years. What have been the changes? How are you coping with it yourself? I mean, you've been teaching everybody, but then what are some things that you do by yourself for coping with all the stress that comes with being a CEO?
I make sure that I have time in my day every day to meditate. That is an extremely important aspect of improving brain health, lowering inflammation. That inflammation does cause a lot of these disease processes that we're talking about, cancer, diabetes, just so many things are affected by inflammation in the body. And our perspective is kind of what causes our intake of our surroundings. And so
Right.
when you're stressed out, you're anxious, you're having all of these feelings and emotions, it causes and inspires things in your body that create inflammation. So I look at it as my daily practice for it's like my daily medication to lower inflammation and avoid disease. So meditation is very important, and being in nature, getting outside a bit, and respecting the circadian rhythm and how our bodies are supposed to be in accordance with it. Making sure that I have a good like hygiene on tech and sleep hygiene as well. So the basics of the foundational points of having and creating a healthy lifestyle, sleep, having appropriate sleep, nutrition, exercise, all of those things. Yeah.
Um, so meditation, right? But for the uninitiated who are just starting out on their meditation experience and journey. So, do you think people need to learn methods of meditation? Because, I mean, I read somewhere it could be wrong, but then people who are not experienced with meditation tend to fall into negative spirals when they start thinking about negative things during meditation rather than going into the positive loop. So, how do you deal with that? Has it ever?
Yeah, so I basically, when I'm teaching meditation, I explain the different brainwave states that we have. And I explain, right now you and I are in beta. brainwave state. We're talking, we're alert.
Yeah.
But when you are in that state of like, you're spacing out and maybe you're driving and you can't remember when you got from point A to point
Yeah.
B or whatever. That's kind of where your brain needs to be at, not driving, but you want to be sitting in a quiet area or like, and you must focus, like you said, on positive thinking because at that point in your brainwave state, you're actually open to creating new neural pathways. And that is working with your subconscious and just setting up that neural network that will help you sustain that perspective of positivity. So, and Harvard says that meditating every day from 10 to 27 minutes or 12 to 27 minutes actually helps you build gray brain matter. And that's the neurotransmitters that you're setting up in your brain. So I explain it from a scientific standpoint. And then I also teach different methods to meditation to get there because I think in our lifestyle today, with
Yeah.
go, 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 and just everybody being so accessible that it's hard to shut down. So I
Yeah.
do teach different methods so that people can play with it. It can be a fun experience in different ways to
Yeah.
experience meditation. So I've been doing that for many years, different styles,
Yeah.
of meditation. Yeah.
So now we'll come to the content. You talked that you've written books, and I saw you had a LinkedIn profile. But your company does not actually have a lot of social media presence, right? I'm guessing
Yeah.
it's a business thing, but would you like to help the audience as to why specifically you chose not to do that? And then how do you send out your message to your clients or audience?
Yeah, so we do a lot of marketing by the traditional route,
Yeah.
which in our industry it's very important
Yes.
to do so because we're
Yes.
meeting with families in person and that sort of thing. The social media aspect, we've touched upon it, but we're not highly focused on it, only because it's been a matter of time and budget and all of that. I have brought on some experts to start working on that. So hopefully, this is part of that journey, like doing the podcast. We have several lined up, and we're going to be featured in US Today. So there's some things we're trying to do to improve that. Yes.
So, have you ever tried using LinkedIn to spread your message, or has it been that people have reached out to you that, yeah, we want to connect? So, do you think there were any specific triggers that worked while you tried that?
So we have been using LinkedIn and it's been pretty effective in gathering folks that are local professionals, healthcare professionals, or professionals that are working towards supporting the senior population and families. So we are using LinkedIn. We do have a page. It's under my profile. I think you can get to it through there from Leah. It's actually Leah Marie is what my profile is under. But Perfect Care Match Company, you should be able to find it. Perfect Care Match Massachusetts, Perfect Care Match Maine, or Perfect Care
Yeah.
Match Massachusetts. Yeah, is what we have. Or corporate is the other one too.
So, how's it been? I mean, not talking about the business itself, how long has it been? And then, what are you expecting in the future?
Yeah, so as I mentioned, 2020 was when I actually started this company, but I've been actually doing the wellness route and teaching it for about 20 years now. I
Yeah.
used to hold retreats, and I'd like to start that again, as well as we start bringing on franchisees and across the United States and set up in different parts of the country where families can come to a retreat and de-stress and learn different techniques while their loved one is being supported with care by
Right.
one of the caregivers. So that's our goal, is to eventually get there.
Thank you so much, Leah. It's been great talking to you, and I guess the audience has a lot to take from this conversation. Thank you for joining me in on this episode of Your Lab Central. To the audience, if you like the video, give us a like and do leave your comments. What do you think about the conversation? And if you have some questions for Leah, happy to help. Uh, Thanks for joining me.
Thank you.